speaker, Dr. Thomas Lechner, and he is with ONO Pharmaceuticals. He's Vice President of Medical Affairs, and he brings over 20 years of oncology, medical affairs, and clinical development experience in the US and Europe. And he recently joined ONO Pharmaceuticals. He is really going to educate us today about a disease. It's brain cancer, but it is incredibly rare, and it's important for all of us to know about this disease, number one, but secondly, it's important for all of us to start understanding why it's often not diagnosed right away and potential treatment options for this disease. So we are delighted to have Dr. Thomas Lechner joining us right now. Thank you so much.
Thank you, Delan, for the very kind introduction. And let me just share my screen, and hopefully we don't have any technical difficulties.
We have you backed up over here if we do.
Okay.
Okay.
You can see everything?
Yes.
Excellent. Thank you so much. So good morning, good afternoon, good evening, good night to some participants. Thank you so much for having me, Delan, and the EBCI team. It's really a pleasure and an honor to be here. And I have to say the stories of the nominees just inspired me, and again, is a reason why I get up and go to work every day. So very, very moving, and very congratulations to the winner. It was an incredible story. I have to do a little disclaimer, of course. I am an employee of ONO Pharmaceuticals, which is the sponsor of the Prospect study. And just to give you a little bit of background, ONO Pharmaceuticals is a over 300-year-old Japanese pharmaceutical company. In the last couple of decades, they have been doing some groundbreaking research, and many of you might have heard of a drug called Opdivo, a PD-1 inhibitor that really revolutionized how some solid tumors are being treated globally. And ONO Pharma, the scientists there in Japan, actually developed the drug, and they are not distributing it in the United States, but ONO is behind the research. So a long history of bringing innovative drugs to patients in need. I'm going to talk about a product called tirabrutinib. It is an experimental drug. It's not approved in the United States yet. It's approved ex-US, but the study that I'm going to talk to you about later hopefully will lead to that approval, but right now it's not approved. I cannot give any medical advice during this presentation. And should you be interested or know somebody who might be interested in the study or be a candidate, there is an email listed here that gets you in direct communication with the study team. And some of my colleagues are actually on this call as well. So there's the clinical team that runs the study. You can get additional information, go to clinicaltrials.gov, where you can also find the centers that are participating. But you can, of course, contact me directly. So here's my email. I will show it again at the end of my presentation. So please feel free to reach out with any questions you may have, and I make sure that I get you in touch with the right people, or even with clinicians if need be. You can certainly also call this number here. That is our general office number, and the colleagues there also know to get in touch with me or with a respective colleague. And if you choose to call, please mention my name. So let's get started and talk a little bit about the disease that we're talking here, primary central nervous system lymphoma. It's a rare lymphoma, so it actually arises from the immune system, from white blood cells, and it arises from diffuse large B-cell lymphoma, which is a very common lymphoma. However, this disease manifests predominantly in the brain. Sometimes it can be found in the spine, in very rare cases in the eyes. So the annual incidence is fairly low, so it's a rare disease. It afflicts 1,500 new cases, patients every year in the United States, but it is a highly aggressive type of non-Hodgkin's lymphoma. And the fact that it is manifest mostly in the brain is the reason why it is being treated and considered a CNS tumor. It does present some unique challenges, and there's certainly a high unmet need. As I said, it's a rare disease. Nevertheless, it is about 4% of all brain tumors, and the incidences are increasing. It usually afflicts patients that are above 65 and older, And fortunately, we all do get older, but of course, that leads to an increase of specific tumors, and PCNSL is one of those. Delan mentioned that could be a delay in diagnosis, and I get into the diagnosis and the specific challenges with the diagnosis a little bit later, but that can then lead to a poor prognosis. The diagnosis also includes brain biopsy, so this is an invasive procedure, and again, is sometimes a challenge. Getting the drug into the brain or drugs into the brain can be a challenge, as there's the blood-brain barrier that in a healthy individual, of course, has an important role hindering toxic substances getting into the brain, but on the other hand, is a challenge to get medications into the brain and to the brain cells. And the currently available treatments, and there is not an approved therapy for relapsed and refractory PCNSL, and I will talk about that later. But there are several chemotherapies and also radiation therapy that's being used, or monoclonal antibodies, and there's a whole list of them, and they can be challenging as well, as they are sometimes not easy to tolerate. And unfortunately, not everybody responds to initial therapy. And there I will talk about the therapies also a little bit later, because there's two ways to go about it. Induction therapy followed by consolidation therapy. But as I said, not everybody responds, or patients unfortunately also do relapse after initial response. So how is the disease diagnosed? I mean, the symptoms can be kind of, common symptoms include nausea, vomiting, could be headaches, difficulties talking, if the eye is impacted, or the nerves leading to the vision changes can occur, weakness, or even seizures. And sometimes that leads to admission to an emergency room. So not necessarily these symptoms, they may indicate that there's a CNS involvement, but they also can sometimes, lead to initial diagnosis that is different. To truly diagnose the disease, a multidisciplinary team is needed, and it may include the general practitioner or the ER doctor, a neurologist, or even an ophthalmologist if the eye is involved. But to really get to a diagnosis that then will initiate treatment, an MRI and a biopsy of the brain is needed. So you can see by this journey that it may take a while to get the diagnosis, and every day that's lost to get into treatment, of course, impacts on the prognosis. And what complicates matters more is if you are closer to New York or Boston, where we have what we call academic centers, Dana-Farber, Memorial Sloan Kettering, MD Anderson, just to name a few, there, of course, you have the specialists and all the equipment in one place to get a diagnosis quickly. But if you're far away from those centers, and your first physician is your general practitioner or a medical oncologist that is not a specialist for this disease, it could take some time until you get the right diagnosis and the right treatment. So how is the disease treated? The initial treatment, there's two parts. Usually it's called induction therapy, which is a form, most of the time, including high-dose methotrexate. So a form of chemotherapy that's given, and then the physicians together with the patients decides later on if they go for what's called consolidation therapy. So after an initial response, one could then move on to receive further therapies that could sometimes include radiation to the brain, or more and more often these days, it's a stem cell transplant, because of course, if that works, it has a curative intent. The team or the physicians that provide these treatments can be hemato-oncologists, neuro-oncologists, radiation oncologists, or oncologists. So you can see also by the origin of the disease being a lymphoma or originating from lymphoma cells, very often hemato-oncologists are involved, but of course, the neuro-oncologist and neurologist also treat the disease. So after receiving your initial therapy, the patients are being monitored via routine eye exams, MRIs, and spinal fluid assessment. And if there is indeed a relapse or the disease is refractory, and I mentioned that is unfortunately often the case, we call this the relapsed and refractory PCNSL. And there is no approved therapy for that kind of disease. And therapy could then include re-challenging with chemotherapy, so another round of this high-dose methotrexate given, radiation, or you can be enrolling in a clinical trial. And that's, the reason why I'm here today, because I wanted to make you all aware of our ongoing prospect study. So this is a phase 2 study where this molecule tirabrutinib is being investigated in patients that have relapsed and refractory disease in this part of the study. So they have to have received prior therapy, and it has to be high-dose methotrexate based therapy. And I get to that later because that is sort of the standard of care in the initial treatment. So patients that do not respond or relapse will then be administered tirabrutinib at 480 milligrams once a day. What is tirabrutinib? It is a small molecule. It's a tyrosine kinase inhibitor that inhibits a kinase, the so-called Burton tyrosine kinase, and in impacting or hindering that pathway to function, the tumor cells then stop growing and actually die. The medication is given, as I said, orally once a day. There are 6 pills to be taken, and it has to be administered on an empty stomach. The reason for that is our scientists found out if given with food, you achieve a higher concentration of the drug, but that then comes or can come with the price of having a higher rate of adverse events. And our scientists and physicians thought we don't want to expose patients unnecessarily to that. And given it in what we call a fasted state, that risk can be minimized or can be reduced. What do we want to see? Of course, we want to see response. So the objective response rate, which is a measure that the tumor is actually reacting and shrinking. And we also want to see how long is the response lasting, because patients will be treated with this medication until progression or until they cannot tolerate the drug any longer. So this is the part A of our ongoing study. And we have a part B, and this is a very complicated slide, and I'm trying to get through it in a fashion that I get the key points across, because the main difference here is these are newly diagnosed patients. So if you remember, patients, they went through all the diagnostic workup, they finally have the confirmed diagnosis. They do unfortunately have PCNSL. And then there are the high-dose methotrexate regimens. And I highlighted those in this red bracket, because in the United States, there is 2 regimens that are predominantly used by clinicians to treat the disease. And they both contain high-dose methotrexate. And you can see here some other ingredients, chemotherapeutics or a monoclonal antibody, such as rituximab. What we are trying to investigate, and my colleagues and clinicians at ONO Pharma, together with our investigators, if we add tirabrutinib to these 2 regimens, do we see additional clinical benefit for the patients that are in the study? First, we need to understand, is it safe to add the drug? So you can see here we're increasing the dose. We have SC is called safety assessments. And once we know it can be safely administered, at some point, the participants, the clinicians who run the study, will then determine if we move forward with both these regimens or one into later stages that hopefully will also at some point lead to the approval of tirabrutinib for patients that are newly diagnosed. So this gets me to the end of my presentation. I tried to keep it very short, as Dylan said, very open to questions right afterwards, but also please reach out to either the prospect study team at onopharma.com. Feel free to reach out directly to me. Here's my email again, thomas.lechner@ono-pharma.com, or you can also call this number and ask to be connected to me, or we will get back to you, or I get you in touch with the appropriate person to address any questions you may have about the prospect study. And I wanted to thank Dylan again and the EBCI for the opportunity to represent ONO Pharma and the prospect study team, and to speak on behalf of our company. And I hope this was of interest, and again, here to address any questions you might have in the remaining time of Q&A. Thank you for your attention. Truly appreciate it.
Thank you, Dr. Lechner. Really fascinating talk. And I know you just educated a ton of people about this particular disease, which is incredibly hard to diagnose. And something that I found, the word fascinating is not the right word, right? I found that we have to do something about it, is that there are no approved drugs in the United States to date to treat this disease, correct?
That's correct. There is no approved drugs. There is quite a few drugs that are listed in what's called the NCCN guidelines, which usually leads a physician can use it, but in most cases it's also reimbursed. But of course, it would be better if we have more approved drugs available.
Absolutely. Absolutely. Okay, I'm going to be quiet, and I would love to open this up to the audience to feel free to unmute yourself and ask Dr. Lechner your question, and then mute yourself back again. That would be awesome. Thank you so much. Any questions? Okay, so again, if you know anyone who currently has or will be diagnosed in the future, with this disease, Dr. Lechner just gave you his contact information. I encourage you to share this information with them, with your entire network, because we need to help this patient population, and we can. And we also can move science forward and to the day where we see an FDA approved treatment option in the United States for this disease. Thank you so much. All right.
I have a question.
Oh, go ahead.
Hi, this is Jen Ortiz. My brain tumor is a little bit different, but I was wondering if you have advice for like all tumor patients regarding physical activity and how they should go about that. And also, do you guys currently, again, I may have missed it, I apologize, investigating different types of trial drugs across the country that you may refer patients out to?
To the first question, Jen, unfortunately, I cannot, comment on, give any medical advice here. Would encourage you to talk to your physician. And if I understood the second question, if you're asking, do we have any other investigational products that we are currently investigating in other brain tumors, correct?
Yes.
Yeah, no, we don't. So we only investigating currently tirabrutinib in this rare form of CNS lymphoma, brain tumors. We have other compounds in early development for other types of cancer, such as lymphoma. But this is our only drug that we're investigating in brain tumors right now.
No, I appreciate it. Any investigation of any type is amazing, and thank you for all the work that you do.
Thank you, Jen. As I said before, this is the inspiration that makes me go to work every day. So I'm glad I could provide a little bit of information. Hopefully it's helpful.
Thank you, Dr. Lechner and ONO Pharmaceuticals for investing in this disease. It obviously needs your help. So thank you so much for bringing your clinical trial to the U.S. for this disease. I really, really can't thank you enough. And I know that I'm speaking for a lot of people as well.